Hi, I'm Dr. Castanet. I've explained to you in other videos the cause of neck and back pain 98% of the time. I've also explained the appropriate treatment for that, the most effective treatment for neck and back pain, whether they're from degenerated discs, herniated discs, or just, nondescript neck and back pain that's chronic and difficult to treat. And I've told you about the spinal decompression as the means of treatment for neck and back pain because it addresses the cause 98% of the time for chronic neck and back pain and any of its manifestations, whether it's just neck and back pain or pinched nerve, sciatica, pain down the arm, pain into the shoulder blades, between the shoulder blades, etc. Now I'm going to show you, using a couple of patients, an actual patient receiving spinal decompression treatment for the neck and for the low back, so you can get an idea of how it works. So let's go to that. Okay, so this gentleman is receiving, should I use your name or not?
Don't guess it really matters.
Okay, well anyway, this gentleman is receiving spinal decompression for the neck treatment. He has neck and arm pain. I'll just call him Mr. W. If you see, the way this works is he's resting here with his neck between these apparatuses. There's one of these on each side that capture the top of the skull and behind his neck. This strap here secures his head so it stays down. And then this sled apparatus here moves this way. What it does then is it opens up, takes pressure off of the discs, nerves, and joints in the neck. Real simple concept. It's essentially the same concept as traction, except it's a much more sophisticated engineered table for that purpose. It's very slow, smooth, does exactly what needs doing. Again, not a complicated concept, but it does directly and exactly what needs doing in the neck and the back. Necks and backs get compressed over time. It's a slow, progressive process. That process can give rise to herniated discs, bulging discs. They can pinch nerves, causing pain down the distribution of the nerve. That physical process is responsible for neck and back pain 98+% of the time. The most direct and effective treatment for that problem, that process, is to reverse it. If you do that, most people, the vast majority of people, are going to get significantly better, and they're not going to need injections and surgical treatment. I've been doing this for 28 years, with 18 years in orthopedics and physical medicine, physical therapy, 4 years in a neurosurgical practice. So I've used a lot of different treatments over that course of time. I've used this for the last 9 years. This is the most effective treatment I have ever used by far for neck and back pain, because it does exactly what needs doing to address the cause of neck and back pain. Thank you for being a model, sir. And that's it for the neck. I'll show you an example of a patient receiving back pain so you can see what that looks like. Okay, so now I'm going to explain the spinal decompression for the low back. Very simple setup. When you have something that's engineered beautifully and very effective, there's also generally an elegance in its simplicity, and that's true for this machine as well. This is the SpineMed spinal decompression table. I think I may be the only one in Georgia with the table, and if you call the manufacturer, they'll tell you that, I think. In any case, it's a beautifully engineered table. I've been using it for 9 years now. Again, I told you it's the most effective direct treatment for the purpose of most neck and back pain, including for sciatica, which is what we're treating this young lady for. The way that works is you put them on the table. I have this strap underneath the ribs to secure the upper part of the spine from T12, L1 area up on that half of the table. The lower half of the table is attached to these horns, or calipers you might say. These are capturing the patient above the iliac crest, or the pelvis. This part of the table moves this way. That separates the pelvic and sacral regions from the T12L1 region, so that the lower part of the low back from L1 to S1 is opened up, decompressed. That's the most direct way to treat the cause of 98+% of neck and back pain. That's why it is the most effective treatment available for those kinds of problems. I have mentioned in other videos that 98+% of surgeries are decompressive in nature, whether it's discectomy, stenosis, or fusion-related surgeries. They all are decompressive in nature. That's how they relieve pain. That's why they're effective when they're effective. It's a mystery, and it makes no sense that pre-surgical treatment is not directed at decompressing the spine. It's possible to do, and it's the most effective way to do it when you can do it sufficiently. And most of the time you can do it sufficiently with this table. In any case, that's how the table works. It's very slow and smooth. It's almost imperceptible. I'll make note too that unlike some other tables that are designed to provide traction or decompression, there is no restraint in the upper arm area. If you do that, if you restrain part of the body at the upper arm area, you are dissipating some of the force by pulling at the shoulder blades and the thoracic spine and regions that are irrelevant to the problem down here in the low back. So it's better if you can most specifically address the area that needs decompressing. The closest you can come is to get the lumbar region. You can't direct it specifically at one segment of the lumbar spine, but you can in the lumbar region from the lower rib region to the pelvic region. That's from L1 to S1. That's what this does so beautifully. I said a moment ago that it's almost imperceptible to patients when you're treating them. Do you want to comment? Do you feel anything now? You do. But it's not much of a perception, right? It's pretty gentle?
Yes.
Yeah. Many people fall asleep on the table. That's probably the rule rather than the exception. With a combination of the low lights, the white noise from the computer, and the stretching, most people just fall asleep during the process. So it's generally very comfortable. It does require typically a series of treatments. For a mild problem, it may require 2 to 6 treatments. For a moderate problem, probably more like 8 to 12. For a very severe problem, it's quite possibly 20 and sometimes even more treatments. But again, it's the best thing we have available. Not perfect, but the best treatment we have available by far for difficult neck and back pain. Thanks very much.